Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning. Good morning. You know, it's Saturday, and it's February the 25th.
It's Saturday.
Saturday.
Yeah.
What does Saturday mean to you? Except that you have to rush from here to your office because you
Saturday.
have Saturday
I look forward to Saturday. I mean, you know, the good side. I guess it's a good side because I save money. Friday I don't go out because
That's true.
I
Same
have the
thing
show.
with me, right?
Yeah, I have my show on Saturday, so I don't go out on Fridays. For Valentine, I was planning maybe I was gonna go away and do this and do that, and then I say, you know, I had to go to my show. I had to go to work, so the heck, I'm just staying
That's
home.
right. You have to come here.
So Saturday, but you know, different people, they do different things. You know, in the Jewish religion, right? From sunset on Friday to Saturday, you do nothing. And I have one of my patients who is a rabbi, and sometimes he will come on Saturday because he traveled to Las Vegas, come back, he has businesses there and what have you. So one of the member of the synagogue was really sick, and the rabbi said, "Go and see Dr. Mencia. He's my doctor, and he's open on Saturday." Because she said, "I don't want to go to an emergency room."
Right.
You know, all the thing they're gonna do. Dr. Mencia, he know the religion. He will be respectful. He just gonna take care of you and send you back.
But Saturday for a rabbi to tell him to go to you, that's
and
pretty
that's what
serious.
she said. That's what she said. She said the rabbi gave me permission to come.
So it's called Saturday Services at the HGI Medical Center.
Yeah, and it's you know, it becoming more. It was just me and Ina and Juan and Oscar and just like 2 or 3 guys.
4 people.
Yeah, like four of us. We started this Saturday thing.
That's right. We started, about 3 or 4 years ago? It's been a while.
2012, 5 years.
Yeah.
Oh, my God.
May 21st will be 5 years.
She's
Wow.
so good. She's a human calendar.
Yes, she is so good.
Because that was an idea you had.
Yes, and we started seeing patients, and it just grew exponentially. It was crazy. And then we started breaking our own record. Hey, we saw 30 patients. Ooh, we saw 37. We saw 40. We saw...
And the record was 56.
56 patients.
Yeah, but the interesting thing is you now have brought in a lot of your specialists
and
on
now
Saturday.
it's a full... Exactly. Now it's a full service. So we have right now, Anita, because after me, then I say, let me open my dental department. So I have Dr. Fadi, Saki,
Dentist.
He is an excellent implantologist, so he does implants and stuff like that. He is so good. He is such a great dentist, great personality, and he was such a match to me because, he's beautiful bedside manner, and he cared for the patient. I say, Dr. Fadi, you're gonna be my co-host here on the Saturday AGI special.
Well, and you just fixed up your beautiful dental offices.
So then we fix up the
gorgeous.
dental department. So then we added the dermatologist. Then we added the podiatrist. So now we have dermatologist, podiatrist.
Recently we added a neurologist and an OBGYN.
A neurologist on Saturday.
Amazing. You can't even get a neurologist
You
on
tell me
weekdays.
where you're going to find a neurologist on Saturday.
And
At
she's bilingual.
only,
That's a good plus.
I'm bilingual, yeah. He speak what, Southern American and Northern American?
Yes, something like that.
So we have the
But you have
the
nutritionists.
OBGYN.
Okay.
The nutritionists
Right.
come on Saturdays. So, they pick one Saturday out of the month and they all rotate through the office. So they don't come every Saturday like we're there. But when we see the patient and we say, you need to see the neurologist. No, I can only come on Saturday because I cannot take off from work. Okay, we'll get you on a day that we match you up with a neurologist or the OBGYN. And
So let's see. You said
the dermatologist.
the dentist, the dietitian, the dermatologist, and the podiatrist.
Neurologist.
A lot of people.
Yes.
And you have all those offices there that they can go in.
They can, exactly. They can all
And
go
of course,
in.
you have a lot of the. I know you have testing. I mean, that you can do right there. People don't have to go, right?
They don't have to go
any
anywhere.
labs.
We do all the lab in there. A lot of doctors, they don't want to waste the time. Sometimes they don't have the phlebotomist to draw the blood. So they just give you a prescription to go to Quest or LabCorp, and then you go there and you sit in another waiting room and you wait for somebody to bring you in and get the test done. Which I do sometimes when it's very sophisticated test that the blood need to be frozen and what have you. I say, this is better to go to one of the main lab, special lab, and let's get this thing done. But most of the blood tests are done. 99% of the blood tests are done in-house when the patient wants to.
But this has always been your theme. You don't want people to have to go to other places for appointments. You want to oversee everything. So this is what you see.
Absolutely. And it's nothing mandatory. I have patients. I know I have, a bunch of patients that come from far away. And they say, doctor, it's such a long drive over here. Can you just give me a requisition? And I go to one of the labs close to home. And I give them a requisition that has my code so that the lab, when they do it in Miami or West Palm Beach, that they will send that to me. And it comes through the internet, so the computer will connect and send me the results, so I can call the patient, or when I see the patient the next time, review everything with that patient.
Well, you're bringing up a point, and I just want to ask you. When someone is tested, let's say that you see when we had that wonderful Donna on the other day,
yes,
and
yes,
and you say, "Gee, I want to get this. I don't like what I'm seeing, and I want to get it tested." Now, that person is nervous. So sometimes it takes a week. Now, what is the problem? Why? I'm just being bad about this, but if you're wondering what's going on in your life, to wait a whole week, why does it take so long to find out what's going on?
See, the people that dedicate themselves to do blood work in a big laboratory, you have to imagine the volume of blood that goes to them. That was one of the main reasons that I decided to open my own lab. Because since I only do lab for my patients, I can get the result the same day.
Yay!
So by the end of the day or the next day, if the person came in late, within 24 hours, Sherry already have results from me, and she even worked for me on Saturday so that she was able to bring the result and put everything back the next day.
But you can understand that.
It's like the ultrasound guy. When I send, a guy and a girl we have now.
Yes.
One does the echo and the other one, we have three now.
Oh,
yeah, one
really?
that does the vein for venous insufficiency, the other one does the vein for, because they specialize, when you are a sonographer, you specialize in this different areas. So I want to cover all areas that are concerning to the baby boomers and the geriatric patient, and for the general population for that matter. So that I provide the best service moving forward. That's my thing. I want to make sure that when people come to me, I'm not just dragging you through. No, if I'm going to do something, let's do the best thing possible. So that and
that's who you are.
And you see with Stonewater, we have
Yes.
taken this company, and I say I want to provide the best services.
Well, people don't really know. We have
Stonewater.
to talk about Stonewater again.
Yeah.
Okay.
So we are remodeling
Stonewater.
and making it so beautiful, and the thing with the ultrasound, and Brinton is so good. He will do let's say check your liver or your pancreas or your kidneys, and he will come to me before the patient get out of the table. And he will go, Dr. Mencia, I checked the liver is sort of enlarged, and I see this spot right here. that is of concern. And before the person is out of the table getting dressed, we are already having a referral set up,
Oh, my.
going to the next test, right away so that we evaluate. Because the ultrasound is not done as a screening. It's done because there's something prompted the test. For example, the liver function started going abnormal, going higher than what it should be. So we start doing all the workup and everything for any condition that would any abnormality. So not only sometimes you don't even have to wait 24 hours. It's an instant result. It's right then and there at the office. And I think that's the kind of service people want. That, if I'm the patient, that's what I want to hear.
Definitely. I mean, if you tell me all of a sudden, I don't like the way this looks,
right?
All of a sudden my heart drops, right? And now you send it away to a lab, which people do, and they'll say, well, I'll know in 3 or 4 days. You know what those 3 and 4 days are like? Sheer misery. But do you understand that? But a lot of them know that's the way it is.
Well, I tell you, I have Maria, one of my patients. She's been my patient for probably I think over 10 years, easily, I would say. Over 10 years, she had been my patient. And she said, Jehovah's Witness, no blood transfusion, blah, 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 And she came to me. And she said, my bowel movement, I don't know if I have irritable bowel syndrome. I said, okay, lay down on the table. Let me examine you. So she lay down, and I listened to her intestine, and they sounded normal to me. I said, no, I don't think you have IBS. So I'm listening to her. Then I started examining, just like you said, diagnostician. I start looking with my medical eyes.
Yes.
And I noticed that one side of her abdomen, where you have the midline right on top of your belly button, you have that midline that goes through. And then you have muscle on both sides. But one side was bulging on the left more than the right. I said, the liver is on the right. I wonder if she's one of those people that have the abnormality with the liver on the other side. I never had an ultrasound on her because she's an HMO. HMO won't allow you to do any of those things. Some of them. So I said, with my hand, let me see what I can feel. So I felt with my hand. I said, there's a lump here. I don't like that because the pancreas is there. So I said, you know what? They won't let me do an ultrasound. Your HMO won't let me do an ultrasound at the office. And I hope they're listening because they refer so many patients to me. They won't let me do an ultrasound on you. They won't pay for it. But I'm going to do it anyway. I don't want you to go home with this thing. I want to see what's going on here. So we did an ultrasound. Lo and behold, she has a pancreatic mass. Pancreatic mass, until somebody proves to you otherwise, you don't need tissue to see what it is. If it's a scar on the lung, if you're a smoker, they say, well, it's a scar on the lung. It could be cancer or it could be just an old scar. We don't know. Until they go there and do a little biopsy, they won't be able to let you know that, yes, it's a scar. They have nothing for you to worry about. But when you see that in the pancreas, you usually cancel until somebody proves otherwise. So she came in and I said, listen, I'm going to order a CAT scan because I know your HMO will pay for that. But I'm going to refer you to see Dr. Larrison right away. We call Dr. Larrison. We say, this is an emergency. And they know me. I've been working with Dr. Larrison for 20 years. When I call and I say it's urgent, they put a patient in. They say, Dr. Mencia says it's urgent. He knows what he's talking about. Get the patient in. So they got her in. He took a look at the preliminary test that we have. And he said to her, go back to Dr. Mencia, get the blood test. He said, no, Dr. Mencia already did the blood test. He knew you're going to do surgery. He already done the blood test. He gave me the prescription for chest x-ray. Everything is done. He said, oh, perfect. So let's schedule this. So she come back the next day just for the clearance and on an empty stomach. Called the whole family. The daughter is calling me, what the heck is going on with my mother? What are you doing to her? I said, well, we're trying to save her life, So I explained to the daughter, how aggressive pancreatic cancer could be. And I don't think the mother knew that pancreatic cancer was so aggressive, but I didn't want to bring that up. The last thing you want to do is scare the patient. Mm-hmm. So, but the daughter, I explained, this is why you guys have to make sure she follow all of this appointment. We're going to move quick. If we are wrong, all we're going to do is, look and do the CAT scan. At any point, we can stop. But we're going to continue to move as if it is. And if the CAT scan show us different and it says only a benign cyst or something like that, then we'll stop. So the daughter, okay, sounds like a good plan. So we move on with that. They called the other family out of state. Everybody came in from California and what have you. And by the time the family was arriving, she was already operated. So she was already in there, operated. And it was pancreatic cancer.
Now what?
Now she's living a normal life. She had a very minor surgery, which was to remove the tail of the pancreas. The cancer was located on the tail of the pancreas. It did not invade any organ around there. The lymph nodes were all negative, and we heard from Dan about lymph nodes last section that we had. All the lymph nodes were negative, so it was a blessing from God. They said that, wow, this woman just laying down on the exam table, we were able to pick this up. So, when we see the volume of patients that we see, because, we are busy. Besides that, I lecture to physicians and nurses, nurse practitioners. So my day doesn't end up at 5 o'clock. It continues. I love teaching, so I love educating other doctors. And one of my main motivation to teach other people is because geriatric medicine is so underserved in this country. It's incredible to believe that such a developed country don't have less geriatrician than UK. UK produce much more geriatrician than we do here. It's a pity to see people say, I'm going to go out of the country to see if I can get a second opinion on something.
But we've talked about that before, and we've told everyone that in South Florida, doctors, general practitioners who deal with the seniors call themselves geriatricians. They said, but they don't understand. Why don't you make that clear since we're on the subject?
No.
What was the extra work that you did to become a geriatrician?
Well, I did my 3 years to become an internist. An internist is a person that specializes on the adult population, everybody above the age of 18 and above. So I did 3 years as an internist. Then I did 1 year as a chief of the residency program, so chief resident for 1 year. Then I did 2 extra years to become a geriatrician. And it was waking up, going through, having lunch, working late hours, only dedicated to the elderly patients, baby boomer and elderly patients.
What kind of coursework was that?
And, it's, for example, looking at medications. And just like we treat, when you are a general practitioner, you give medication to a baby, and you can give it to a geriatric patient. When you give medication to a baby, they are so vulnerable that the dosage and the frequency have to be very well controlled. You have to see how much weight the person weighs and what have you. When we study as the body ages, regardless how well we look and how we're doing, the function of some of the organs is not the same as when we were 30 years old. The bones are more fragile. The kidney doesn't work as well. The heart might be a little bit dilated. The blood vessels, you look at the blood vessel of an elderly person in the laboratory. You take a piece of an arterial piece from a 90-year-old person and one from a 20-year-old person. And the one from the 21 is flexible, you can expand it. The one from the 90-year-old is harder, has less compliance, so it moves less when you try to pull on it. So the blood vessels tend to get tougher. And when they do that, then that's why we are so prone to high blood pressure as we age. And that's why it's so important to monitor our blood pressure as we age, because the blood vessels, they tend to lose compliance. And many factors can contribute to that, because there are some geriatric patients, either because of genetic and or because of their lifestyle. You know, they never smoke, they never eat the wrong food, they don't eat fast food, they eat on time, and they follow a very healthy lifestyle. And you get patients that get on their 90 and still have excellent blood pressure. The blood vessels are still have enough compliance that it's not like that 20-year-old, but maybe like a 30, 35, or 40 years old. But if you are 90, you have the blood vessel of a 40-year-old. That's damn good. Excellent to have. So the same thing with the kidneys. You know, you drink plenty of fluid, you take care of your kidney, you don't depend on medication. The kidney will continue to function, but we tend to produce damage to the kidneys when we follow the wrong lifestyle. To give you a good example, is a person with what they call borderline diabetes, which means that when you eat a lot of sweet, your pancreas cannot handle the volume, the load of sweet that you are giving at a given point in time. So the sweet, you say, hey, I'm not a diabetic. You don't know. You are not checking the sugar when you're doing that to your body. You might be pre-diabetic. You might have the gene for being diabetic. It had not just pronounced on you as of yet. But when you do that, and there's a wedding cake or a birthday cake, and you decide to go and eat half of that cake, and your pancreas, most of our pancreas cannot handle that, but all the sugar will do damage. Just like when you take any medication in excess will do damage to your body. And the damage can be permanent. So one of the very well-known factors about sugar is that sugar is a fuel for the tiniest blood vessel that we have in our body. And they are located behind your eyes and on your kidneys. So, and I wrote the book on the kidney, Protect Your Kidney, so the kidney can protect you.
Great book.
It's on Amazon. It's at the office. And we talk on the book about, how the sugar can be detrimental to the kidney, because the blood vessel, when it gets thicker, like we explained before, at the kidney level, you cannot filtrate anymore. And those people won't jump from normal kidney to dialysis, but they will go and produce some permanent damage. And that's why you see some people, they go to the nephrologist, the kidney specialist, and they say, your kidney is functioning at 80% of normal. That means you lost 20%, my dear friend. When they go to the nephrologist and say, your kidney is functioning at 40% of normal, you lost 60%.
I have to drag you back to our question and the geriatrics, because we're going to run out of time. So what I'm hearing from you is that where typically a general practitioner knows a certain amount, the general information.
Right.
But because you then went and had the 2 years.
2 extra years.
Yes. So you took each one of the things and how it affects a person over 60, 70, which is different. The medication, the way you handle them, the blood pressure, right? So you're saying that you have this specialized information for the older adult.
For the older adult. And a lot of people don't understand that even specialists, let's say a psychiatrist that is a general psychiatrist, did not specialize in geriatric psychiatry, which is another specialty that is out there, or a cardiologist that never studied geriatric medicine, can give you the wrong medication or can give you the medication in the wrong time. And I get so many patients that come to me from a cardiologist that they say they put you on one blood pressure medication. It's not working. Now they put you on 2. It's not working. Now they put you on 3. It's not working. But each prescription say, take one a day. Take one a day. The patients, they don't know. They say, okay, when I wake up in the morning, I just take all 3 of them.
Right.
And that's one of the major things as a geriatrician. We say, no, split those blood pressure medications so you are covered around the clock. If you take diabetic medication, why take all of them together?
Okay. Yeah. You know what? I haven't given out So if somebody wants to come see you on Saturday, they need to know how to come see you, and I'm going to help everybody know that. Just write this down. It's Pencil Talk Radio. Please, it's Pencil Talk Rodeo. Yeah, right.
Hey, go to the rodeo.
Right. Get your pencils out. It's 954-489-1345. It's a very important number. Put it up on your refrigerator. 954-489-1345. If you want to go down there now, it is Saturday. The address is 1608 East Commercial Boulevard, and it's in Fort Lauderdale. And I don't know if your Boynton Beach is open today. If your Boynton Beach is open or not.
The Boynton, no, it's not.
No, okay. So we're just going to have you go to the AGI Medical and Dental Centers. And, I don't know if we can do this. I don't think we have time. About the text? Okay.
Yeah.
If you want a text to be able to get something over at Stonewater, write this down, 954-280-0855. And you'll get that, and then you have to text
Stone.
Okay, Stone.
STO.
Okay, you text Stone, and then you're going to get something back to be able
They'll
to
send you
get
the
some
special
discounts at Stonewater Med Spa. Now, the phone number is Stonewater Med Spa, 954-561-8799. We always have so much to talk about. Dr. Mencia comes in here, and what are we going to talk about today? Oh, my gosh, it just goes on and on. Thank you for being here. Make sure you go down to see Dr. Mencia and all his wonderful colleagues. You will be in good shape. Thanks, Dr. Mencia.
Thank you.
Ina.
Thank you.
Thank you, Ina. Thank you,
We'll be
Anita.
right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.